With more than 9 million veterans enrolled and nearly 320,000 full-time employees working in hundreds of facilities, the Veterans Health Administration is the most extensive healthcare network in the United States. Our goal at VHA's Office of Patient-Centered Care and Cultural Transformation is to work with veterans, VA leadership, healthcare providers, and staff to change the way we deliver care. We are transforming the traditional medical model, which focuses on treating specific symptoms, diseases, and conditions, to one that promotes whole health care, engaging and inspiring veterans to achieve their highest level of health and well-being. To help veterans reach their goals, VHA is applying the elements of patient-centered care, a model that starts with an exploration of what matters most to veterans and then partners with them to achieve their best possible health. First and foremost, the voice of the veteran informs how VHA delivers care. Healthcare environments, teams, methods, and more are all designed to support veterans on their journey to health and well-being.
Now that I've been attending these programs, I feel for the first time in the last 3 years I have had more peace in my life than I've had in the previous 40. I feel very empowered. The environment is so positive and so uplifting that I go to these events just to be around these people. These programs have got me back, and life is just the way it should be, you know.
VHA is on the cutting edge of research about the effectiveness of an integrative approach to healthcare. Our studies have shown, for example, that mindfulness can be a powerful force in helping patients manage depression, pain, mental illness, and anxiety. We're educating our staff to incorporate a whole health approach to care. Since 2012, more than 1,500 employees have completed the Whole Health Clinical Course, just one of many programs offered to VHA staff members across the country. Taking an analytical look at how the delivery of care affects patient outcomes allows us to identify which areas are working and which areas need improvement. For instance, after committing to patient-centered practices, the Washington, D.C. VA Medical Center documented notable improvements in how veterans perceive their care. We are listening to veterans and partnering with them, not only in promoting their whole health, but also in driving VA's cultural transformation. The voice of the veteran can help us enhance VA's culture, processes, and capabilities to put the needs, expectations, and interests of veterans and their families first. We are taking an evidence-based approach so we may apply practices that achieve the strongest outcomes to our education and training and deploy this patient-centered approach across VHA. We want patient-centered care to reach every clinician, every staff member, and every patient, to create a healthcare system that can lead our veterans to their highest possible level of health and well-being. For more information on patient-centered care, where we stand now and where we're headed, read this year's story, presented by the Office of Patient-Centered Care and Cultural Transformation.